Hello, I'm Ernie Bjorkman, and welcome to the American Health Front. Our program explores the fascinating frontiers of today's healthcare, with reports on new techniques and technologies that could change your life. Throughout our program, you'll meet experts who may have just the help, skill, or medical service you need. You may want to sit down with a piece of paper and pencil because there's nothing more important than your health.
First on the American Health Front, a physician whose talents go beyond the operating theater.
Few physicians achieve true international renown in even one subspecialty, let alone two. Today we're going to meet the exception. Chairman of the Otolaryngology Head and Neck Surgery Department at Graduate Hospital in Philadelphia, professor at Jefferson Medical College, and author of more than 500 publications, including 21 textbooks. Dr. Robert Sataloff is recognized throughout the world as the preeminent expert in the care of the professional voice, and is one of the world's leading authorities on surgery of the ear, ear-brain interface, and skull base. As chairman of the Voice Foundation and physician to singers, actors, politicians, and other voice professionals throughout the world, Dr. Sataloff's new clinical techniques, technological advances, and instrumentation have been praised by media sources ranging from Charles Kuralt to the New York Times. His widely lauded contributions to arts medicine in general and voice medicine in particular have been enhanced by his own accomplishments as a professional operatic baritone and his more than 30 years of experience as a university choir conductor.
Actors, and especially singers, are the Olympic athletes of the voice world and have led the development of arts medicine, which is a lot like sports medicine. The new technologies and advances in treatment, especially surgery, that have been inspired by singers have raised the standard of care for everybody with a voice problem. Teachers, clergy, and even those of us who just like to go out and scream at football games.
Today's story focuses on Dr. Sataloff's formidable contributions to the care of patients with disorders of hearing, balance, and the skull base. First, we asked the doctor how he came to specialize in both hearing and voice.
My father was one of the original ear specialists known as otologists, and I fell in love with the anatomy of the ear and knew I wanted to be an ear surgeon even as a child. But I always loved music and started studying singing when I was 13 and singing professionally at 15. When I became an ear, nose, and throat resident at the University of Michigan, all my music friends called up when they had laryngitis, and I went to look up what to do, and there wasn't much there. So developing a field of professional voice and learning more became not only a professional quest, but also a personal one.
In addition to his extensive experience in surgery for hearing loss, chronic ear disease, and skull-base tumors, such as acoustic neuromas, Dr. Sataloff has made special advances in treating birth defects of the ear. In fact, the good doctor won a National Research Award for his work on birth defects.
When I was in training, many surgeons refused to operate on people with birth defects of the ear because of the risk of facial paralysis. My embryology research has helped make surgery safer for children or adults born without ear canals or middle ear bones.
Dr. Sataloff tells us that surgery performed on tumors of the skull base is among the largest surgeries performed on humans.
I originally developed this surgery in collaboration with Drs. Malcolm Graham and John Kemmick at the University of Michigan. Originally, because of the complexity of the skull base and the nerves, blood vessels, and brain that are all bunched up there, tumors in this area used to be considered hopeless. The surgery we developed allows us to remove those tumors. It's heroic surgery. It sometimes takes as much as 24 hours to do the operations, but it can be life-saving. For example, a young mother with a cancer of the skull base might be willing to undergo even major surgery of this sort to have a chance to be around to see her children grow up.
Other new exciting projects the doctor is working on include cochlear implantation, tinnitus research, and the treatment of balance disorders, as well as further refinement of stapes surgery for autosclerosis, utilizing laser technology.
I'm very hopeful that over the next several years we will make continued progress in treatment of people with hearing loss of all severities, advance the treatment of people with tinnitus or ear noises, dizziness, skull base tumors, and we are clearly continuing to make great progress in the management of voice disorders and especially in the care of those wonderful singers and actors.